Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Overview of Hives Urticaria, commonly known as hives, is a disorder that affects up to 20% of the population at some point in their lives. /r/n/r/n hives usually feel very itchy and burning or cause a tingling sensation, and these symptoms often make people miserable. The swelling that sometimes accompanies hives, called angioedemacan, lead to swelling of the face, hands, and feet and is often painful. /r/n/r/n In my allergy clinic, I see people every day who suffer from hives. Some people have had symptoms for a few days, whereas others have had symptoms for decadesyet. Each and every one of them is extremely bothered by them. /r/n/r/n The good news is that through a proper evaluation and treatment plan, almost all people who suffer from hives can achieve good control of their symptoms, although they may not be able to be cured. /r/n/r/n Most people have a suspicion of what could be causing their hives, and these suspicions range from concern over a food allergy, a medication or environmental trigger, such as an odor or chemical, or a physical trigger, such as heat or cold. /r/n/r/n While any of the above triggers are possible, the most common cause of acute hives, those lasting less than 6 weeks, is a viral infection such as the common cold. The most common cause of chronic hives, those lasting greater than 6 weeks, is chronic spontaneous urticaria, also known as chronic idiopathic urticaria. In this form of urticaria, there is no one specific trigger that causes the hives, but rather internal mediators, typically benign, that lead to recurrent hives. /r/n/r/n In addition, stress can cause hives, whether or not the stress is good stress, going on vacation, or bad stress, death in the family. /r/n/r/n Physical causes for hives occur in up to 15% of people with hives. Each one of these forms of physical hives has unique features that warrant special consideration. /r/n/r/n In many cases, an external trigger for hives may not be found. In these instances, medications are used to control symptoms. Non-sedating antihistamines, taken by mouth, are the medications of choice for the treatment and prevention of hives. While oral corticosteroids are sometimes used for a few days to reduce symptoms, these should not be used long-term, and other therapies should be started. /r/n/r/n Xolair, omalizumab, a monoclonal antibody against IgE, significantly improves hives in more than half of patients with chronic spontaneous urticaria. This is the only currently FDA-approved systemic therapy for chronic hives refractory to antihistamines. /r/n/r/n In 2024, the Food and Drug Administration, FDA, approved Xolair, omalizumab, the first medication to be approved to reduce allergic reactions caused by IgE. This includes reducing the risk of anaphylaxis in people aged 1 year and older who may accidentally be exposed to foods they are allergic to. Xolair should not be used for the emergency treatment of any allergic reactions. /r/n/r/n Some oral medications that are much cheaper than Xolair are also used off-label to treat chronic hives, including cyclosporin, sulfasalazine, and dapsone, among others. These can cause side effects and would require monitoring. If hives are not improving with antihistamine therapies, it is recommended to discuss possible therapies with your allergist/immunologist. /r/n/r/n Hives can turn a person's life upside down, as they are uncomfortable and often affect a person's daily functioning, whether at home or at work. While people who suffer from hives are not alone, this isn't much of a comfort to them when their lives are consumed with not knowing why they have their symptoms, and all of this can lead to emotional distress. /r/n/r/n Yet, be assured that hives are often easily treated with medications. Please seek out guidance from your healthcare provider if you experience hives, and especially a specialist, like an allergist, if your hives persist for more than a month or recur over time. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.